Welcome to our aging puzzle. I am your host, Corlette Deveaux. Our show is about aging and how it affects all of us. We will have one-on-one conversations with guests from all walks of life that have been impacted by life and aging. Whether they are seniors, middle-aged, or young folks, guess what? We are going to bring their stories to you. We are so excited every week to hear stories that will touch our hearts, make us laugh, be inspired. We also gain valuable knowledge on current topics, health issues, and how to live longer, healthier lives. We look forward to connecting with each other through learning and listening. Now, this month is Breast Cancer Month. And in recognition of Breast Cancer Month, we have brought to you our very, very special guest, Dr. Michelle C. Powell. Dr. Powell will share her breast cancer battle and opens up about everything that happened with her, about her diagnosis, the importance of screening. She will share with us since her treatment what she has had to do, and she has become a tireless and passionate advocate for women battling with the disease. Now, hopefully, we will help inspire patients, survivors, caregivers, and everyone else who have been affected by breast cancer to bring awareness to this disease. Now, remember, every month we have one guest on our show, and that guest walks us through their journey week after week. So remember what we do every week. Week one, you're going to hear the big reveal. How did they hear the news? Dr. Powell shared how she heard the news that she was diagnosed with breast cancer. Week two, always talk about treatment options. When you have a situation, what are your options? Why were those options recommended to you? Week three, we actually hear about what treatment did you actually choose? Was it effective? Did it have side effects? We like to find out everything because we want to share everything with you. And last, week four, we bring them back to hear the outcome of their treatment and what happened, how are they doing, and are they doing things differently? So join us every week to hear our guests walk you through their journey. And this month is Dr. Michelle C. Powell. Now, every week, you know what we talk about, aging facts, because we're all aging every day. Nothing we can do about it. Fact, did you know that men can also get breast cancer? Yes. Breast cancer is typically thought of as a condition that happens in just women. Nope. Everyone is born with some breast tissue, so anyone can get breast cancer. Male breast cancer, however, is rare, but it can happen, and mostly in men over the age of 60. Male breast cancer diagnoses are more common in people who are Black. Yes, sadly. And about 1 out of every 100 breast cancers diagnosed in this country is found in a man. Wow. Invasive ductal carcinoma. The cancer cells begin in the ducts, and then they grow outside the ducts and into the parts of the breast tissue. Now, studies have shown that women are the strongest risk for breast cancer. Unfortunately, the treatment for breast cancer in men follows the same guidelines as women. There are several other risk factors that can increase the chances of developing breast cancer, such as age. Yes, nothing good happens with age, but we all go through it and we have to accept it. And I say it every week, there's nothing good about being overweight. Obesity increases your chance of a lot of things. Drinking alcohol, folks, we got to stop drinking alcohol. I say it every week. And if you have a family history of breast cancer, you have to pay attention. Exposure to radiation, reproductive history, tobacco use, postmenopausal hormone therapy are all risks that increase your chance of getting breast cancer. So I encourage everyone, whether you are a man or a woman, if you think something isn't right around your chest area, go check it out. See your healthcare provider ASAP. Because remember, early diagnosis and treatment has a significant impact on your long-term prognosis. And when you go to see your healthcare provider, be honest, guys. Tell them what's going on. How long have you had the symptoms? If you've had risk cancer, if there's a risk in your family, tell them that. Talk to your provider about how to detect breast cancer early and about your family history. So guess what? Early detection is the key to better outcomes. And another fact, let's not forget this, foods. You always want to have foods that are high in antioxidants. And those foods include berries, dark leafy greens, pumpkin, carrots, nuts, and seeds. So you, me, we will all age gracefully. So our topic for this month is breast cancer awareness. And every 2 minutes, statistics shows that a woman is diagnosed with breast cancer in the United States. Every 2 minutes. It is important to note that breast cancer can affect anyone regardless of age, sex, or gender. And while this number seems overwhelming, there is some good news. Breast cancer rates in the United States began to decrease from the previous 2 decades. But what do these numbers actually mean? Well, for one, it seems that while breast cancer remains the most prevalent cancer in women, scientists are working to overcome all of the issues and help with early detection and to also identify ways to treat breast cancer so that the survival rate is increasing. But it is also overwhelming to make sense of some medical options when you are given a diagnosis of breast cancer. It's very confusing. But it is recommending that you understand more about the types of breast cancer, and we encourage everyone to learn about the anatomy of the breast. Now, check this out. I didn't know this, but there are dozens of types of subtypes of breast cancer. Here are just a few of them. Hormone receptive positive, HER2 positive, triple negative, ductal carcinoma, lobular, inflammatory, metastatic breast cancer, just to name a few. And depending on the details of your diagnosis, treatment options for breast cancer can include, you can have surgery, chemotherapy, radiation, targeted therapy, hormone therapy, immunotherapy. You've got a lot of options. And remember, no breast cancer patient is the same. Each person's experience is different and requires a personalized approach to treatment. Every patient has their own set of needs and concerns, and therefore, the treatment plan should be tailored to each individual. Now, please, we encourage you, we've been doing this all month, stay up to date on your annual checkups. It's important. And don't forget self-breast examination. We already know that it can be tempting to delay them, you just ignore them. If you ignore them, they don't exist, you'll be fine. No, do not ignore them. It is essential. Ignoring can put you in a situation where it is too late because early detection is the key to better outcomes. Healthy behaviors can help lower your risk. However, we are learning that everyday stress, environmental toxins, such as hormone replacement therapy, can also be a factor in increasing your risk of breast cancer. Come on, I encourage all of you, all of my guests out there, take time for yourself. It is important. No one knows your body better than you. Take the time to do self-breast examination. It doesn't matter what age you are, and it doesn't matter if you're male or female. Do self-breast examination. And watch what you eat. Everything that we get, diseases, are all contributed to what we put into our bodies and what we have around our bodies. Remember, we talked about this last week. What you put in and what you have around your body affects your health. So please be safe, eat well. Now, I want to take a moment to welcome our very special guest, Dr. Michelle C. Powell. She has been a beacon of light and hope for many, many, many years to a lot of patients, friends, and family members. She is a board-certified osteopathic family medicine with over 25 years of experience. She has emphasized her lifestyle and made changes for long-term positive outcomes for herself and for her patients. She addresses obesity, diabetes, and hypertension. But Dr. Powell, a dear friend of mine, has given so much tirelessly to people in our community. She is the founder and CEO of Powell Health Solutions, which delivers affordable and quality preventative health care with a holistic approach. She is a lecturer all around the globe, and she, as a spokesperson, challenges thinking and behavior to achieve better outcomes. And you've heard from her. She was diagnosed with stage 2, stage 3 breast cancer, and she has survived it, and she is sharing our stories. Dr. Powell has had to implement her own teachings when she personally was diagnosed with breast cancer herself. Today, she's a thriving survivor, and she shares her experiences to women and families with the goal of helping to improve and positively impact breast cancer survival among underserved communities and around the country. You know, her patients love her. They describe her as kind, sweet, compassionate, loving, knowledgeable, and committed to their well-being and the betterment of all. That's the beauty of Dr. Michelle C. Powell, our fantastic guest today. So please join me in welcoming again this week, Dr. Michelle C. Powell, who will talk about the treatment that she selected for her stage 3 breast cancer. Well, I have here my special guest, Dr. Michelle C. Powell. Welcome, Dr. Powell.
Hello, hello, welcome, welcome. Great to be back again.
It's fantastic. It's so awesome to have you again for the third week. We have you all month, and we are here talking and listening and learning from you about your story. You are a breast cancer survivor. This week, we want to talk about the treatment that you went through. Tell us about that. What treatments did you select in your treatment paradigm? And tell us about how the treatment was, if you had side effects, what happened. Tell us everything, Dr. Powell.
Wow, big order, tall order. Who would ever think that treating breast cancer? Well, it's definitely not like, and I'm going to talk like doctor speak, you know, with doctors, and even patients, we think, okay, I have a problem. I go to the doctor, they give me a treatment, like, right? I have a cold, a cough, give me an antibiotics, right? I'm throwing up, give me something for my nausea. I have a pain, give me a pill for my pain. Unfortunately, when it comes to treatment of breast cancer, it's not a treatment. It doesn't work like that. It's multiple treatments. And depending on how far the cancer has moved, will determine how many treatments you get. And I have to thank Dr. Rivers, who really broke it down to me, because my thoughts were, okay, I got 2 breasts, you know, one's infected. Well, let's get rid of both of them, just be on safe side and keep it moving. And she had to say, slow your brakes. It doesn't work like that, because your cancer has spread to your lymph nodes, which means that just removing the breast tissue that supposedly have the cancer will not in any way treat the lymph nodes that are infected and prevent it spreading anywhere. So for some women, the cancers may be what we call localized, just in one area, right? It looks like a dot, look like a golf ball, look like a strawberry. You can go in, take that, do what they call a lumpectomy and take out the cancer. If it's spread a little bit, they may just take the entire breast. But when you get to where I was, stage 2, 3, where now my lymph nodes were involved and it was trying to move to the rest of my body, she says, no. I'm going to be honest with you. Your treatment is going to involve everything.
Oh, wow.
Yes.
So tell us everything. What does everything mean? You know, like really describe what everything means for our audience.
Okay. So the options out there for breast cancer are the one I always tell people, don't do that, which is do nothing. Just sit on it. You know, for some people, they say, well, I'll just, you know, got to die for some reason, or no, God will heal, or my faith will heal me, or it's not there. It doesn't even exist. It's not there. So I'm just going to ignore it. Well, I do believe in faith. In fact, I believe my faith brought me through this journey along with love and support. But do nothing was not my option. I don't recommend it. The other option is the number one, which most people use, is chemotherapy, which is a chemical treatment to fast-growing cells, and fast-growing cells are cancer cells, plus the one in your mouth and on your hair and nails. So that's why people lose their hair. Sometimes their nails have problems with taste, nausea, and vomiting, because those are fast-growing cells. And then the third option is radiation, where a beam of radiation is attacked. They use computers now. They don't just radiate your whole body like a microwave.
Like they used
now
to
use,
before. Yes.
yeah, they're very sophisticated, and they narrow the beam of light to the area that needs treated. So yay me, I got all of them.
Yeah.
I had to do all, and the reason was because my breast cancer wasn't localized. It wasn't just in one place. It wasn't small. It was almost 5 centimeters, and it had spread into my lymph nodes on my right side. So I started with getting a port, which is a device under your skin where they will hook up the IV with the chemotherapy. And I still have my port. See?
Okay. Oh, I see. Yes.
I still have my
Okay.
port. It's getting better. It's clearing. I have it removed, but the scar is still there.
Mhm.
And I opted, you could actually do chemo getting an IV every time you go, but I was going every 3 weeks. And so, look, I'm a wimp when it comes to needles.
Most of us are.
Yes.
Yes.
And,
No.
and I wasn't going to have someone, come on, baby, give me that arm, get that thing out.
Right.
No, we're not doing that.
Yeah. Oh, that's painful.
So
Huh?
I opted for the port. So every
Okay.
3 weeks, I would get hooked up to a bag of chemicals, starting with Benadryl to keep me from having a reaction, prednisone to suppress reaction again, and then I was given 2, 3 other chemical agents to help reduce the cancer cell for an entire year.
Mhm.
Every 3 weeks, I went through this, and it took 8 hours to receive the medications. So I
Wow.
sat in a chair with my little computer and my movies.
Did some work. And
Did
you
mostly
were able
work.
to eat. You were able to eat, right?
Yeah, ate, not that great, but I ate a little bit.
Mhm.
I probably was, the whole experience, I think I was like a nibbling bird.
Yes.
Ate a little this, a little of that, and then the taste changes with the chemo. The
Mm.
first month, everything tastes like pepper,
Oh,
cotton
wow.
balls and pepper. Yeah.
Wow. Oh my goodness. And
Uh,
so the first couple of weeks, the first couple of times that you went, how did you feel after the first chemotherapy? How did you feel? And kind of walk us through what you felt like the week after, the second week after, and the third week after chemotherapy before you had to go back again for the
yeah.
next round.
It's fallacy that chemo, when you get it, that you're going to be sick. Okay. It's different for person to person. Depends on your tolerance, depends on the type of chemo they're giving you. But my experience was, because they'd given me all these things not to have a reaction, the Benadryl, the prednisone through IV, when they gave me the chemo that day, it was like I had some juice. I had nothing, no side effects, nothing. I was ready. I could do anything. The next day, I gave myself a shot, and that shot was to keep my white blood cell count from going so low, because when the white blood cell count drops, it causes you to get infections.
Oh, wow.
So I think I lost you. So we opted to give myself an injection to keep my white count up, because most people end up in the hospital from chemo because their white count drops so low, and it makes them easy to get infection. So I opted to do that. Now, after I got that shot, within 2 days, it was like I had the flu. My body was weak. I could barely move. I spent most, and you visited me. I spent
Yes.
most of my time with my best friend, my recliner.
Yes. Yes.
For 2 years, my
I
recliner
remember
became my
that.
best friend. And I recommend everybody get one,
A
because
nice
mine was
comfortable recliner. Recommended by
was
Dr.
cool.
Michelle Powell.
My recliner, and you press the button and it lift you up. And that was
Yes.
really important because my legs were so weak. I couldn't climb stairs. They were so weak. I made decisions. Do I go to the chair or to the bedroom? Oh, to the chair is closer.
Yes. Your best friend. The chair was
My
the
best
best friend.
friend.
Yes.
Yeah.
Wow. So you did that. So you went through this every 3 weeks for a year.
Yes.
So you did
Now,
the
after the
chemo
first
for-
week, that chemo side effect, like a flu, only lasted about a week.
Okay.
And then I was able to go back to work for 2 weeks.
Oh, okay. And so you went back to work after the first chemo, and then you were able to continue working while you were going through chemo every 3 weeks.
So I 1 week on, off, 2 weeks on, once for the whole
The
year.
first week you couldn't go to work. For the next 2 weeks, you can go to work, and then you went back to chemo
Yes.
the fourth week, and then you just kind of kept that cycle going.
Yes.
Okay. So, oh, wow, wow. You know, chemo is a very difficult thing. So you said, a couple of options here. One option for you was not to do anything. That was not an option. You actually went through chemotherapy. Tell us, you did chemotherapy for a year, every 3 weeks. Did you do radiation therapy? And then tell us about the final part, which is the surgery that you had.
Well, so I'm going to go in the order that Dr. Rivers, she said to me, I'm going to tell you, you got 3 things to do. And I'm going to tell you the hardest of them is going to be your chemo. And she's absolutely right. The next thing that I did was to do the first surgery. The first surgery was done August. I started chemo in March, and then I had my first surgery to remove both breasts. And at that time, when they removed the breast, I then had to be out of work for 6 weeks as they took off both breasts. I received drains. They put the drains in because after they removed the breast, they put in what I call my Tupperwares. They were space savers. That was to expand your skin. The most horrific experience because space savers are not like prosthetic breast augmentation that women get. They literally feel like Tupperware. You couldn't lie on your chest, lay on your side. I constantly had to have pillows next to me because they really were like laying on cinder blocks. And I had those in to expand the tissue until end of October when I started radiation. And the whole time I'm still doing chemo.
Right. So
And
you chemo during this whole time.
Yes.
Then you had your breast removed and you put the Tupperware in. And then while you're doing chemo, you had radiation.
Then I also did radiation. So, and the radiation, they mark your skin because they're going to localize to where they're going to treat. And for my body, they were going to treat from top of my clavicle down to below my breast, along my arm. And she was absolutely right. Of step 1, chemo, the worst. Step 2, prosthetic expanders, on a scale of 1 to 100, that fell in 50 range. And the easiest was the radiation.
Wow.
Yeah, because the radiation, I was able to go to work and immediately, half an hour for radiation, get up, go to work, go back. But it's every single day for 30 minutes.
Every day for how long?
I did that for 25 treatments, except weekends, every day.
Yeah.
So I finished right before Thanksgiving.
Yes, I remember. The radiation wasn't painful, right?
You don't feel anything.
It was a pain in the neck because you had to go every day, but there was no physical pain like the chemotherapy.
No,
and the
just
Tupperware.
cold. You lay on a very cold table and you have to lay there and, while you get the treatment, which really only lasts maybe 10, 15 minutes. The majority of the time you're just getting undressed, getting in position, treatment for 15 minutes, get off and go back to work.
And do that again for 25 days, 24 days.
Yeah.
Wow. Wow. So for our listeners out there, you've gone through this whole process. You had options for your treatment for your breast cancer, and your treatment was chemotherapy for a year, breast removed, the tissue removed, Tupperware placed in there to keep your skin stretched
Spacers, yeah.
as a placeholder, and
Yeah.
then you did the radiation. And then after that, when did you get the actual implants put in? And then when did you complete your entire treatment?
So then after I finished radiation by Thanksgiving, I now had to continue my chemo, which ended at the end of January, but you have to wait 6 months after having the initial surgery and for 3 to 4 months after radiation, because the skin has to be healed to undergo additional surgery, and they didn't want the skin to break down. So you have to wait anywhere from 4 to 6 months before putting in the doing the what we call reconstructive surgery.
Right.
And that's where we put the implants. So I had that in April. So my second surgery was in April.
And this was
yeah,
April 2022.
now we're in 2022. Yeah,
Okay.
a year
So I
ago.
just wanted to share with my listeners that this is recent.
Yeah,
This
very
is,
recent.
it is, what is today's date? It is October
4th.
2023, and we're talking 2022, little over a year ago
Yeah.
that you were going through this, and you concluded. And I remember, I remember going with you to see that doctor, the reconstructive surgeon. She was actually phenomenal.
She's
She's
phenomenal.
very good.
Yes, yes.
Phenomenal.
Dr. Yates.
So yes, and so you finish all of this, if you were to wrap this up in a summary and to tell people what to expect when they're going through chemotherapy for breast cancer, how would you summarize this, Dr. Michelle Powell? Tell us.
Yes. And for summary, and I also want to share something that was a little different and, very spiritual person. And I've become so much more. When I knew I had to do surgery, I was thinking, oh my gosh, who do I know? The doctor that initially did my biopsy, never, Dr. Harris, the most awesome doctor. He's over at North Shore Hospital. He found the cancer, but I also had to go through all these other things, and I wanted to be in one place. So I was referred to, well, I had a number of referrals, and that's what I want to tell the listeners. You're going to have lots of options, and there's no one who's going to say, this is what you're going to do. You're literally going to have to be the person to decide. And I was looking for the name of a doctor for a patient to remove hidradenitis, and I couldn't remember the phone number. It wasn't in my electronic medical records. And so I Googled the doctor. And as I went to the doctor's webpage, the first thing on our webpage was reconstructive surgery. And I was like, wow. And because I had sent other patients to her, I said, wow. And it says, this is her expertise. She had had multiple extensive training in it. I thought, wow, this is a female and she does reconstructive surgery. So I called and I was able to get an appointment immediately. It got even better. She referred me to another female doctor, who's Dr. Rivers. And what was most awesome about these two doctors, unlike most recommendations, do the surgery, then do the reconstruction. We'll think about saving the nipples for the reconstruction. Both doctors were present at my first surgery. They did surgery together in order to do what we call nipple sparing. They removed the breast. They tested it immediately to make sure the nipples didn't have cancer. And the plastic surgeon worked with the oncology surgeon, and they worked on me together. And that is an option that not many people know they have. And it took a while to get it. But like Grace, I was looking for somebody and just everything fell in line. And so the message I would tell people is there's not a one cookie cutter or one cookbook for your treatment. You're an individual. You have tolerances. Some people can tolerate chemo. No problem. Some people, radiation made them feel sick. Some people opt to do one thing. I have one lady in my practice who went through 4 treatments of chemo and she couldn't do any more. So you are going to have to select what works with your spirit. But more importantly, be comfortable with your decision. Be comfortable with it, but don't go with the first thing thrown at you. Do your research.
Options.
Look at your options, but don't read too much. I never read the side effects of the chemo.
Mm-hmm.
I knew what I was getting, but I didn't bother read them because I didn't want to have everything that they said. So
Right.
I said, okay, I'm getting chemo. Okay, whatever. Hook me up.
Yeah. Yeah.
Because sometimes the mind will play with you, and you have to be very,
Absolutely.
very conscious during treatment, not to let negative energies to take on things that are stressful to you. And I maintain a space of positivity, joy, peace, prayer, meditation, laughter, and love. And that's what you have to do to make it through.
That's fantastic, Dr. Powell. And I will tell our listeners, my listeners out there, I was there with Dr. Powell as she was going through this, and she is talking about what the positive mentality that she kept throughout this whole process, and she is absolutely correct. She was positive, she was warm, she shared her story through social media so that she can help people out there as she was going through this process. So Dr. Powell is the real deal. She went through it, she shared it, she wants to help someone out there.
But Corlette, I can't claim it. I learned it from the best teacher, Lori Jones. I got it from the best.
Yes, you're absolutely
I
correct.
got it from the best.
You're
I had
absolutely
a
correct.
friend who went through her cancer journey, and
Yes.
she did it with so much grace and joy and love. I would be embarrassed to do anything but what she did. Anything but what she did. She taught me how to do this journey. And if it wasn't for her, and this is Corlette's best friend, if it wasn't for her and her demonstration, I could never have taken this journey with such peace
And grace.
and grace.
Because she never once gave up, and she never once said, why me?
Never.
Never. Lori
She had a
Jones.
smile her entire time. So I had to do it with grace. And I'm telling you, listening out there, be graceful, be peaceful, be kind, be loving, because you're going to make it. Yeah. Thank you. Thank you, my love, for having me.
Yeah. Oh boy, it's a little rough right now, Michelle. Yes. Thank you for being here. I appreciate you so much, and I love you with all my heart.
Love you too. Thank you.
You're
Yeah.
the best. You're the best.
Thank you. Thank you. Thank you.
Wow. What an awesome interview. I will tell you, you know that it brought me to tears. It brought me to tears. And we talked about our dear friend Lori, who passed away over 20 years ago from a rare form of cancer. So cancer is very near and dear to Dr. Paul and myself. And we want to encourage all of you, get checked up, self-examination. Don't miss your annual exams, please. Your life depends on it. Now let's talk about habits to live longer and live better. Every week we talk about ways to live longer and live better, and we always recommend 4 things. Let's go through them again. 1, proper diet. Eating a healthy diet has multiple benefits. It's going to strengthen your bones, protect your heart, reduce diseases, improve your mood. So come on, eat healthy foods and establish habits that's going to help you live longer and live better. Number 2, regular exercise. Get up and get out. Any kind of activity. When you sit down, don't do anything, and you're sitting around, that's not good. You've got to get up and get out. Do anything. Walk. Do balance training, muscle strengthening, walk around the block, anything. But sitting around is not going to be good for you. When you do these things, you're going to help strengthen your body, and it's also going to make you feel better, and it's going to elevate your mood. Exercise elevates your mood. and it makes you feel better. Number 3, stress. We all have stress. We know that. But you have to figure out how to manage your stress. Aromatherapy is a form of alternative medicine that uses essential oils to promote relaxation. Reflexology is a form of therapeutic massage that focuses on applying pressure to certain points on your feet, your hands, or your ears to stimulate nerves and improve circulation. Whatever you want to do, find a way for you to relieve some stress and relax. 4, socialization. Everyone needs someone to love. Remember that song? We all need somebody to love. Find a small group. It's not about quantity, it's about quality. How good are those friends to you? How do they make you feel? Find a group of friends. Cultivate those relationships. Go to the movies, grab a cup of coffee, check out a museum, anything. It doesn't have to be crazy stuff. It can be cheap, free, anything. Find low-key activities, but find a friend to do it with. Because when you're with a friend, it makes you feel good, makes you feel loved, and makes you have less anxiety. So remember, these are the 4 things we recommend every single week. Doing these things to have a positive effect on your overall health and will help you live longer and live better. Remember this month, our topic, breast cancer awareness. The month of October every year is Breast Cancer Awareness Month. If you want to learn more about the types of breast cancer, please visit the American Cancer Society or breastcancer.org. And this month, let's paint the world pink and do everything we can to continue raising awareness about prevention, the importance of early diagnosis, and access to treatment. And let's support those who have gone through this journey so together we can all make a difference. Remember, every week our sponsor for our aging puzzle is DG Incorporated. DG Incorporated is a marketing and business development powerhouse providing strategic guidance, business planning, and business coaching to entrepreneurs to help them grow their business. DG Incorporated is an entrepreneur's growth partner to help them build, operate, grow, and repeat. And remember, to learn more about our sponsor, DG Incorporated, you can visit their website at dgincorporated.org or follow them on LinkedIn at DG Incorporated. And we invite you to subscribe to our YouTube channel at Our Aging Puzzle and watch us every Friday evening at 8 p.m. We also invite you to subscribe to our sponsor's YouTube channel at DG Incorporated. And again, thank you to our very special guest, Dr. Michelle C. Powell, for sharing her journey through breast cancer. We hope to see you next week for the last week with Dr. Michelle C. Powell to find out how she's doing and what she's doing after cancer. Thank you for joining us. Voila! See you next time.
I'm Kevin Harrington, an original shark from Shark Tank. DG Incorporated provides coaching services to help entrepreneurs open and grow assisted living facilities and build economic wealth. Visit their website to learn more.